Hey everyone, welcome to the Lee County Literacy Coalition Health Literacy Program. This is the third and final session of our pharmacy series. Our first session talked about what a pharmacist can do for you, and our second session talks about the importance of immunizations, such as the flu shot. If you haven't listened to these sessions, you definitely should. This session is called Reading Prescriptions and Community Resources. My name is Shelby, and I'm a pharmacy student at Auburn University, here to talk to you about how to read prescriptions your doctors give you and the different resources in our community available that can help you with your medications. The first thing that we are going to talk about is how to read your medication bottle. It is important to know what medications you are taking, why you are taking them, and how you need to take them. By not taking your medicine right, you could decrease how much your medicines can help you, and you could even put yourself at risk of more side effects. We are going to spend some time walking through what you can find on your prescription bottle label. Always remember, if you cannot find something on your prescription bottle, or if you have any other questions about your medicine, you should always ask your pharmacist or doctor. They're there to help you. It might be helpful if you pulled out one of your own prescription bottles and looked along with me to locate these things. Depending on what pharmacy you use, the label could look a little different, but all labels will have the same main things. Here I have two different prescription label examples, and I'm going to walk you through what you can find on each. This label is what can be found wrapped around your prescription bottle like a sticker. If you have trouble seeing, if you have trouble opening, auxiliary label storage, then ask your pharmacist about those things, because those are all things that pharmacists are trained to help you deal with. This red circle shows who the prescription is for. It will have your name and your address. This is important if you have multiple people in your house and different medications for each person, because obviously you don't want to switch up each person's medication. You want that person to be the one taking the medicine. Now we are going to talk about the pharmacy and the pharmacy phone number. So this red circle shows you where you can locate your pharmacy, the address of your pharmacy, and the phone number of your pharmacy. Usually the pharmacy information will be located at the top of the label, like you see here on these labels in the picture. These are helpful whenever you need to contact your pharmacy or to tell someone what pharmacy you use. Now we are going to talk about your prescription number. So this red circle shows your prescription number. It normally can be found underneath the pharmacy information. This number is a special number that tells the pharmacy exactly what your prescription is. When you need refills, you can call your pharmacy and give them this number so that they know which prescription that you want to refill. This red circle shows what doctor prescribed this medicine to you. Sometimes you might have different doctors that prescribe your medicine, so this is where you can find who prescribed it for you. This will be important if you need more of your medicine or have to make appointments with your doctors about your medicine. This red circle shows what medicine you are taking. The words are the name of your medicine. So in the top picture, this patient is taking amoxicillin. And in the bottom picture, this person is taking metformin. The numbers afterwards show the strength of your medicine. So the amoxicillin and metformin are both 500 milligrams. The last part shows what form your medicine comes in. This is so you can know what it should look like. So these two medicines will be a capsule and a tablet. Some prescription labels can even tell you what your medicine will look like. The bottom picture has an example of this. So this label tells you that your medicine is going to be a white oval tablet with a 93 on the front and a 48 on the back. Not all prescriptions will tell you this, but it is helpful when it is there so that you can recognize your medicine. Now I want to mention some other dosage forms that your medicine might come in. Here I have pictures of a lot of common dosage forms. A dosage form is the form that your medicine comes in. It is important to know what your medicine looks like so you can recognize it, and then the form can also tell you how to take it. The first and most common form are capsules and tablets. Capsules and tablets come in many different shapes, sizes, and colors. Most capsules and tablets are for taking by mouth. The next picture shows another common form, liquids. These can be solutions or suspensions, and they are usually for taking by mouth. And a lot of times your pharmacy will give you a measuring cup or a measuring spoon or syringe so that you can measure the amount of medicine that you are supposed to take. And I also just want to add here, it is really important to use some kind of, measuring cup or measuring syringe, like what they give you, instead of just using like a household spoon or something like that, because a lot of times that's not going to be as accurate, but that's just a little side note. So the next picture is a cream. They are called topicals and can be ointments, creams, or lotions. They are called topicals because they are usually applied topically to your skin. The picture at the far right of the top row is an injection. These look like shots and they have a needle on the end. They are injected into your skin. So your doctor or pharmacist will teach you how to inject this and where to inject it in your skin because it could change based on what you're using it for. An example of when you would have to have an injection is if you have diabetes and you have to inject insulin. The next picture is an inhaler. This medicine is usually taken through your mouth, but you won't swallow it like you would a pill or a capsule. You will actually just breathe it in. So your pharmacist will teach you how to use an inhaler if you ever need one. An example of when you use an inhaler would be if you had asthma or COPD, something like that. The next picture is a picture of drops. This medicine usually comes with a dropper, and they are usually for dropping medicine into your nose, eyes, or ears. So make sure, like we were talking about earlier, about reading your prescription bottle so that you make sure you're not accidentally putting eardrops into your eyes or the opposite. So an example of when you would use these drops would be if you were to get an eye or an ear infection and you have to drop the medicine into those places. The last picture is a suppository or an enema. This medicine is usually inserted into places like the rectum. An example of when you might need a suppository is if you are very constipated. This can help you go to the bathroom. These are just some common dosage forms you may see, and they may all be used in different ways. So the instructions on your label will tell you how to take them. So now we're going to talk about how that you take your medicine. So this part of your prescription label is probably one of the most important parts because it tells you exactly how to take it. So it will tell you how much to take. For example, if you take 1 tablet or 2 tablets, it will tell you where to put the medicine. For example, if the label tells you to take it orally, which means by mouth, then you will swallow the medicine. If it tells you to apply it to your hand, then you obviously would apply it to your hand. It also tells you how often to take the medicine. So for example, the top picture says to take 1 capsule by mouth 3 times daily for 10 days until all taken. So that's a lot of details that you have to pay attention to there. So this means that you want to take 1 capsule in the morning, 1 capsule in the afternoon, and 1 capsule at night. And you are going to take these by mouth, so you would swallow the capsules, and you are going to take it for 10 days straight until all of the capsules in your bottle are gone. The bottom picture tells you to take 1 tablet orally 2 times a day. This means you are going to take 1 tablet in the morning and 1 tablet at night, and you are going to swallow these tablets again. If you ever have any questions that are not on your directions, never hesitate to ask your pharmacist how you can take the medicine. Another thing that some pharmacists do is give you a schedule of when you should take your medicine. So for example, the bottom picture has this. It tells you to take 1 tablet in the morning and 1 tablet in the evening. So that just kind of helps you to keep up with when you're supposed to take how many tablets. So not all pharmacies will do this, but for the ones that do, it's kind of a helpful tool to use. This part tells you the quantity or how much medicine that they gave you. It is often abbreviated as QTY, which means quantity of medicine. So the top picture tells you that the bottle has 30 capsules in it, and the bottom picture tells you that the bottle you got has 60 capsules in it. So now we have discussed the major parts of a prescription label. There are other things on your label that you might find helpful as well. So some labels have extra information that can help you to learn more about your medicine. So the bottom picture has some extra information that you can read to help you. It might tell you side effects or other things you need to be aware of. It might also tell you how to store it, like if it needs to go in the refrigerator, for example, like insulin would if you are diabetic. It could also tell you to shake it if it's a liquid medicine that needs to be shaken. It might tell you to take it with food if it needs to be taken with food. And so, a lot of these medicines just have different small little things that you have to remember in order for the medicine to work the best that it can. And so just make sure to read the whole prescription bottle, even those little extra pieces of information. So they probably look small and maybe not as important, but they really can be. Also, sometimes when you pick up your prescription at the pharmacy, it will come with an extra paper. So this extra paper can have important information as well. So you should take some time to read through the papers that come with your medicine, or you can just ask your pharmacist, what do I need to know about this that's important? And they would be happy to share that information with you. But even if you, like I said, if you ever have any questions, just make sure that you ask your pharmacist. The last thing that I wanted to talk about with reading prescription labels and about getting your medicines is, what if you have trouble with the prescription bottle? So sometimes patients may have trouble reading the label if the words are too small. If this is the case, your pharmacy can usually make the font larger on your bottles or print out the label so that it's bigger and you can read it easier. And then also, if you're just having trouble reading it in general, maybe the words are too big or you don't know how to pronounce this medicine, then you can ask the pharmacist and they would be glad to help you. Sometimes patients have trouble opening their bottles, so maybe you have arthritis in your hands. And so if this is the case, then you can request easy open caps at your pharmacy. This means the bottle will come with a different cap so that it is easier to open. And always remember the most important thing. Ask your pharmacist when you have questions. They are there to help you. So now we are going to shift gears a little bit and start talking about resources in the community. And we are going to be talking specifically about resources in the Lee County area. Many people have multiple illnesses that need continual care. Paying for multiple prescriptions a month can end up costing a lot of money if you aren't aware of different programs in the community and medications offered by community pharmacies in the area. I'll be listing specific examples, but the programs that I'm talking about may be at other pharmacies as well. So just make sure to ask your pharmacist what programs that they have available for you. One of the best resources to find your prescriptions at the best price is needymeds.com. This website makes it easy to search your prescription drugs and see what options that there are to make them more affordable and therefore more accessible to you. Needymeds.com works whether or not you have insurance. Ask your pharmacist what would be the best option for you based on your insurance and the discounts available through needymeds.com. Here are the different options needymeds.com can offer you. You can see the picture to determine what kind of help that there is for you through this website. So if you look at the left side of the screen, so you've just got them all listed. So patient assistance programs, and there are many different types of patient assistance programs. Some even require some paperwork and things like that. So you can ask your pharmacist about help if you have any questions filling that out. And then you've got $4 generics. So that's just certain pharmacies that will offer this particular medicine that you searched for $4. You've got coupons, rebates, and more. And so that can really go into a lot of different things. For example, coupons can help lower your copay if you do have insurance. And so, there's going to be a lot of good information that you can find under that tab. And then you can find additional drug information, which I think is really important because in order, to want to take this medicine, it makes you feel better to know what you're taking and to know what you're taking it for and to have all the information about it. And so that tab can be helpful as well. And then support, so you can talk with someone, chat with someone about what your options are, copay cards, and then drug videos, again, to just tell you more about the different things that the drug can do. So here is an example of the different options for a drug called Entresto. So that I searched Entresto on needymeds.com, and it's a drug that's used for heart failure, but it's typically really expensive. And so you can see that when I searched Entresto, needymeds.com gave me the option of patient assistance programs to apply for support, drug videos, and information. So those are all the things that I just read to you a second ago. So this is great because not only are you figuring out how to pay for the drug, you are also getting information on why the drug is important. So now I'm going to talk about the Walmart $4 list. So Walmart has a list of medications that are only $4 with no insurance necessary. Talk to your pharmacist or follow the link to see if you have prescriptions that will only be $4. Other pharmacies participate in programs like this as well, so it may not just be Walmart, it could be the pharmacy that you use already. So ask your pharmacist if your pharmacy has a program like this that can help you to pay for your medicines. Another option to get your medicines at a better price is the Publix free list. So Publix offers multiple free medications for high blood pressure, diabetes, and some antibiotics. Here is an example of 2 blood pressure drugs that are on the list. Ask your pharmacist about drugs you take that could be on the free list. Other pharmacies have free lists as well, so ask your pharmacist if they offer a program like that at the pharmacy that you use. It is important, even when trying to get your medications at the best price, only to use one pharmacy. Using multiple pharmacies can increase the chance of having problems with your medicines because your pharmacist will not know everything that you are taking. Therefore, look at your medication list and choose one pharmacy that will best meet your needs. Another resource in the Lee County area for medical care in general is Mercy Medical Clinic. So Mercy Medical Clinic is for patients who are medically underserved in the Lee County area. They have doctors, nurses, and pharmacists all there to help meet your medical needs. Mercy Medical can serve as your primary care provider if you do not have one. The cost to see a doctor is currently $25, but will be going up to $35 during 2020. Mercy Medical can also help you to get set up on patient assistance programs to get your medicine at a better price. So, like I was kind of saying earlier, sometimes those patient assistance programs require you to do paperwork, and sometimes that can get confusing and complicated. And so they have people at Mercy Medical Clinic who can help you with that process. They also have multiple resources for your medical needs, including family medical care, women's health screenings, spiritual counseling, and like I've previously stated, patient assistance programs. For patients who are over the age of 60, senior centers are a great resource for many different things, including healthcare. Centers serve as a community focal point where many services and programs can be given to individuals who are 60 or older. The service is free, but donations are accepted. Services include social activities, nutrition education, health counseling, consumer education, recreation and exercise, hot meals, and then just other information that you might need about different resources in your community. So here I just have listed some senior centers that are in the area. And so just pick out which one is closest to you and then just go and see what they have to offer because as you can see, from listening, they're just a broad array of different things that they can do for you. A really important part of taking care of your health is nutrition. If you have ever suffered from not having enough to eat, the Lee County area offers many options to help you. So this first one is the community market. So the community market provides pantry staples, perishable goods, frozen foods, fresh produce, cleaning products, and personal care items for Lee County residents. So as you can see, we have the number on the screen, and so you would want to make an appointment before your first visit with them, and then I have the address on there as well. Another resource for getting food in the Lee County area is the Food Bank of East Alabama. So the Food Bank serves as a resource for Lee County grocery assistance, clothing, public transit, emergency housing, and then medical and rent and utility assistance. So as you can see, they help with more than just getting food. They can help you with clothing, they can help you with transportation. And so that's just a really great resource to keep in mind for, for any of these things that you're having trouble with. The third and final resource that I have listed on this slide is the Supplemental Nutrition Assistance Program, also known as SNAP. So this was formerly known as food stamps, and they provide monthly benefits to eligible students to buy food. So again, I have the number listed for you down at the bottom, and also the website so that you can see the eligibility requirements and fill out the application if you decide that it would be a good fit for you. So finally, I've listed some questions that you can ask your pharmacist about different resources that your pharmacy or community may offer. So if you want to pause this video and write these questions down so that you can remember the next time you go to the pharmacy, you're welcome to do that. These questions will also be provided on a handout located on the health literacy page of the Lee County Literacy Coalition website. So these questions are, one, does this pharmacy have a discounted drug list? And if they don't offer any kind of discounted drug program, then I'm sure that there are going to be other pharmacies in your area that will. And so you can just look into those other options to see if you can get that medicine cheaper. Does this pharmacy have a free drug list? So like I mentioned the example of Publix, but other pharmacies have those lists as well. Do you know of any coupons that I could get to get this drug cheaper? So that could help you with the cost of your copay if you have insurance. And finally, does this pharmacy offer a mail order service for this medicine? And so I didn't really talk too much about that, but some different pharmacies will offer mail order services. And that could be really beneficial if you have transportation problems getting to the pharmacy. Or you could also ask, is there a time that I could come and pick up all of my medicines at the same time? And your pharmacist can help get all of those medicines kind of on the same pickup schedule so that you don't have to be coming in 6 different times a month, so that you can only come in once or twice a month to pick up your medicines. So as always, your pharmacist is there to help you get your medicines and manage your health problems. So make sure to use them. In closing, the community has so many different resources to offer. You can visit the link provided on the slide to look at even more resources in the community. This link will also be provided on the Lee County Literacy Coalition website on our health literacy page. I hope this PowerPoint has opened your eyes to some options you have to get the best care possible and to make your prescriptions more affordable. The information on this webinar is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this webinar is for general information purposes only. Never disregard professional medical advice or delay seeking medical treatment because of something you have read or accessed through this webinar. Finally, if you ever have any questions or concerns about our program, email info@leecounty.literacy.org, or you can call the number listed at 334-705-0001. Thank you for watching this video.